patients with chronic depression have been through the gamut with medications, and they are looking for hope. And so the idea of a non-invasive treatment with magnetic energy is appealing, and it doesn't take any selling. I don't encounter a problem with resistance to the treatment modality. It's learning about it in the first place that is the greatest hurdle for patients getting TMS. And so in our process of an evaluation for appropriateness of treatment, we conduct an informed consent discussion. People seem to understand what we are trying to do with the treatment, and if they can get insurance approval, which they often can, then they're ready for the treatment. They want to know how soon it can be done. The most important thing about TMS in our practice is not exactly where I place the coil. The most important thing in our practice about TMS are the treaters who are delivering the treatments. And so we have licensed therapists delivering our TMS treatments and who interact with patients, interact with each other as a team, regularly confer with one another about how a patient is doing, all for the goal of helping patients get better. And the reason we switched from medical assistants to therapists is that early on we noticed that for patients who have been depressed 5, 10, 20 years, there's more to coming out of a prolonged episode of depression than simply having a better mood. Because for them, depression is not just a mental illness, it's become a way of life. They've given up relationships, they've given up activities. Even their identity has become like, I'm that depressed person who doesn't do anything anymore. So it turns out that the treater, the one who's actually delivering the treatments every day, they're that first person that sort of links arms with the patient and helps them pull themselves towards the life that they wanted to have but couldn't have because their depression was holding them back. So what's special about our clinic in particular is our treatment team.